Thank you, Mr. Chair. Dr. Conway, you're here as CEO of OptumRx, but before that, you were a doctor, actually a well-respected doctor, a pediatrician, as I understand it. And so I want to ask you, when you were a doctor, if you had a 10-year-old, for example, who came in with arthritis, and you recommended or prescribed Humira, do you believe that your judgment would be more valuable than some of your colleagues at Optum who may not have treated that patient?
Sir, I'm still a practicing pediatrician.
Wonderful. So can you answer the question?
In terms of clinical care, I believe clinical care should be based on evidence and the best medicine for the populations of patients.
But you wouldn't privilege the doctor's opinion in that case? I mean, if you were treating a patient, 10-year-old with juvenile arthritis, you say, okay, I think she needs Humira. Would you agree that your opinion should be given more weight than someone at Optum who may not actually treat that patient?
So I agree that prescriptions prescribed by physicians when consistent with the clinical evidence should be approved and given to the patient.
But that didn't happen in the case of Cassidy, right? Are you familiar with this case where she was a 10-year-old girl, she had juvenile arthritis, and her doctor prescribed Humira, but for 6 months there was denial of that medicine, and then the juvenile arthritis spread to her rib cage? Do you agree that that denial was wrong?
So for any individual case, we are happy to look into it with you and get back to you. I would go.
Do you know why that was denied?
I would go back to our process, which was an independent pharmacy and therapeutics.
Are you familiar with the process where you called utilization management?
We have an independent pharmacy and therapeutics committee, which has pharmacists and clinicians.
And what happened in Cassidy's case, because of utilization management, is the committee went back to Cassidy's doctor and said, no, don't give her Humira, even though the disease is spreading to her rib cage and she's in pain for 6 months, because you need to try cheaper drugs first. Is that what utilization requires?
So the vast majority of medications are approved when prescribed.
That's not my question, but is there a policy that you require people to try out cheaper alternatives first and that the doctor is overruled, as happened in Cassidy's case?
The vast majority of medicines are approved as prescribed. There are times when the independent P&T has recommended criteria that be followed, where at times one medicine is tried before another medicine.
And is cost part of the criteria?
The criteria start with the clinical standards and the evidence.
Is cost one of the factors?
No, the first criteria is the clinical evidence and criteria. If medicines are clinically equivalent, then the lower net cost can be considered.
So cost is a factor, and there are times, as in Cassidy's case, that the doctor's clinical diagnosis is overruled because of cost. I mean, the doctor was begging for this to be approved for this girl for 6 months as arthritis spread from her knees and her ankles to her rib cage. And it was denied again and again because they were saying that the doctor needed to prescribe something cheaper. Do you believe that that was an outrageous decision to privilege costs over this girl's health?
So as a practicing pediatrician, I said, and I've taken care of many children with juvenile arthritis, it is critically important to follow the clinical evidence to prescribe appropriate.
But why wouldn't you just say it's critically important to follow the doctor's recommendation? Can you commit to that today, that OptumRx in the future will not have cases like Cassidy, and if a doctor is prescribing a medicine like Humira, will agree to fill that prescription?
For any individual case, for you or other member of Congress, if you want us to look into that case, we will.
But can you make a commitment today that you'll privilege the doctor's recommendation over the bureaucracy's recommendation? This is the heart of why people are so upset at the PBMs. Can you just make that commitment? That you will not override a doctor's, maybe, how about this? Can you commit that if a doctor recommends it twice, you won't override it?
As a physician, I hope you understand this. We value our partnership with physicians.
I'm sure you value it. So then can you commit to taking their recommendation? Why wouldn't you commit to taking their recommendation? Or can you commit to not considering cost? taking cost out of your utilization.
We are committed to the independent P&T committee that we have that is transparent, that includes independent.
It's like lawyers are
and
writing your
pharmacists.
statements.
I'm trying to answer your question, sir.
No, you're not, with due respect, sir. You're not committing to not having cost, and you're not committing to having a doctor's recommendation, even if they have it twice. That if a doctor says, we need Humira, it's denied. Then the doctor says, we need Humira. You're not even committing to accepting that, and you're not committing today, and this is, I'll let you have the final word, and you're not committing to taking out cost as a consideration.
We're committed to effective clinical care for all the people that we serve.
My time has expired.